Welcome to the trauma video series. These videos will demonstrate some of the essential life-saving procedures commonly carried out in trauma patients. It will demonstrate one correct and safe way of doing the procedure, but there may be other alternative approaches. These videos are produced by the Advanced Trauma Life Support team of the College of Surgeons-Sri Lanka in collaboration with the Non Communicable Disease Unit of the Ministry of Health of Sri Lanka.
Now I am going to demonstrate surgical cricothyroidotomy. For that you need cleaning equipment, swab with 10% povidone iodine, swab holders, and you need lignocaine, 2% lignocaine, a number 11 blade and a handle, hemostat. If you have a tracheal dilator, and if you are able to find, you can use either tracheostomy tube with cuff, it's number 6, or you can use a number 6 ET tube with cuff and a bougie. Now I am going to demonstrate how to position. So you have to position in the neutral position of the head, and there should be another person giving manual inline stabilization to prevent extension of the neck in a trauma patient. Then the landmarks are marked. First, the thyroid cartilage, thyroid notch is marked, and then the sternal notch. In between, just below the thyroid cartilage, the next bony prominence is the cricoid cartilage. Then above the cricoid cartilage is the cricothyroid membrane. This is the area we are going to insert the tracheostomy tube in cricothyroidotomy. Right. Now I am going to clean and drape. I am going to anesthetize the area with 2% lignocaine. Right. Once you have anesthetized, you have to stabilize the thyroid cartilage with the non-dominant hand, index finger and thumb finger. And you have to go exactly in the midline and vertically incise with a number 11 blade, about 1 inch. Once you have incised, you have to dilate it with a hemostat and identify by dissecting the skin the cricoid membrane. Right, this is the cricothyroid membrane, and this hard part here is the thyroid cartilage. So you can feel the cricothyroid membrane here. I am going to insert a transverse cut through the membrane while holding the thyroid cartilage with my non-dominant hand. Once I have put a nick, I can either use the handle opposite side to dilate it, or I can use tracheal dilator. Once I have dilated, if I have a tracheal dilator, I can keep it holding like this and insert the tracheostomy tube through it. This is a size 6 tracheostomy tube with a bulb. Make sure you are inserting it chordally so that you don't damage the vocal cords. Once you have inserted it, you remove the stellate and connect it to an ambu bag. Now you need to auscultate and see if there is air entry. If there is air entry, now you can secure the tracheostomy tube with the tape. Alternatively, after you have inserted the neck, you can insert the blade and then rotate it 90 degrees. Once you have rotated, you can insert a bougie. Always direct all equipment towards the caudal side. Once you have inserted the bougie, you can take off the handle, and then assistant should load the ET tube through the bougie. Once the assistant gets hold of the bougie, you are going to insert the ET tube through the opening. You just need to insert so that the bulb is just below the cricoid membrane. And now you are going to remove the bougie while holding the ET tube tightly. Then you are going to connect the ambu bag and try to auscultate and see if there is air entry. If there is adequate air entry, now you need to secure the ET tube after inflating the bulb. Once you have inflated, now you can secure the ET tube by suturing or tape. That's it.